Hello and welcome to IDFC First Bank presents Leaders of Tomorrow Season 11. I'm Sunanda Jayaseelan. To mark World Health Day, we are bringing you conversations with two of the most well-known hospitals in the country to really talk about healthcare as we speak, to talk about some of the innovations that we've seen, but also the big picture on Indians and their approach to health. All of that in tonight's interviews. Let me introduce my guests. First up, I'm in conversation with Dr. Sudhir Kalhan, MS, Chairman, National Council for Healthcare, ASSOCHAM. Also in conversation tonight, Lieutenant Colonel L C Verma, CEO of Godrej Memorial Hospital. Thank you so much, Dr. Kalhan, first off, for joining us here live on the show. So good having you here with us. I want to, kickstart really today's conversation by saying, as we're marking World Health Day, what are some of the big ideas that you have for New India when it comes to the healthcare space?
See, first of all, let us talk about what are the strengths of our country. India is a young, vibrant democracy. The average age of an Indian is less than 30 years of age, and this is our strength. And the weakness of our country is that we have a large population, we have a lot of diversity, and we have a disparity of resources. So if we have to develop a strong India, then we have to unify India, we have to build a great nation with quality education and good health. To me, these are the two pillars of strength which can build a great nation. Now what has happened is in the last 3-4 years is that the tertiary centers have developed a lot. You find all the city swarming with corporate hospitals with the latest technology. But look what has happened to the primary health centers. They are typically collapsed. You don't have doctors there, you don't have healthcare personnel there, the basic medicines are also lacking. So what is happening is people are rushing from B towns, C towns for small things and rushing into the big towns where the cost of treatment is very high. So I think this pyramid needs to be reserved.
We all know some of the grim headlines and statistics when it's regarding India's population and its health, making news for all the wrong reasons when it comes to being, let's say, the diabetes capital of the world, etc. But what are some of the new diseases which are really impacting Indians? What can you tell us in terms of what you've been seeing over the past few years?
You see, when we were in the medical school, we were taught that prevention is the best medicine. 10 rupees which is spent in prevention can prevent lakhs of rupees on the disease, spent on the disease. So I think somewhere while we have treating the disease, we have developed a lot of tests, MRIs, CT scans, and a lot of money is spent on the treatment of the disease. I think the focus somehow has shifted from preventive aspect of medicine. I think that focus needs to be coming back, and we also need to shift our focus from illness to wellness. I think to me that is the most important thing.
Dr. Kalhan, we're seeing a very worrying trend of late, which is that it seems that a lot of young people seem to be getting heart-related diseases, heart-related, complications, heart attacks, heart surgeries. Why is that really happening?
See, this is people keep on saying that why are Indians having more cardiac disease? First, I think unfortunately we are genetically designed in such a way that our coronaries are little, by genetics, they are a little thicker, they are corkscrew in shape, and they are more liable to get into coronary artery diseases. But at the same time, I think what has compounded the heart diseases is our lifestyle disorders. We have become more sedentary in our lifestyle. The children are encouraged to study, but they're not encouraged to run around or do physical fitness. The availability of food, the fast food which is available through the Zomatos and the Swiggies. So we are eating a lot, we are exercising less, we are becoming more obese, we are becoming more sedentary, and this is leading to a lot of lifestyle disorders and diseases related to the lifestyle disorders.
What are the main challenges, according to you, that are plaguing the Indian healthcare system?
See, I think if you ask me what are the challenges of the healthcare system, I think first the major challenge of healthcare system today is providing healthcare to all, universal healthcare as we all say. That means not only urban India is to be treated, we have to take care of the rural India also. We have to bridge the divide, the ever increasing divide between rural and urban India. And I think the only way we can do is using technology. And today I am very happy to say that we are working hand in glove with the government in the Ayushman Bharat digital mission, where digital technology is being created to create small hub and spoke models where rural India will be connected with the high technology urban India, and we will use technology to transfer the fruits of medical growth and facilities to even the people in the village. So I think that is what is really required.
Would you say we are at the right doctor to patient ratio in the country right now?
See, this is a question of the last 4 decades, that do we have the right doctor-patient relation? No, we don't have it. There is unequal distribution of healthcare personnel. Most of the doctors are concentrated in the large cities. When primary health centers are required, practically there are no doctors there. There are no doctors in the villages. There are no doctors even in the C-class cities. The B-class cities also don't have specialists. And similarly is the availability of the paramedical staff, the nurses, the technicians, everything is deficient and there is unequal distribution. But what we need to see is find out is what is the reason for this. Are we giving enough incentives for doctors to settle down into B-class and C-class cities? Are we incentivizing doctors to go to villages and work there? Young doctors can go to, if we give them incentive that okay, if you work for an year in a village, we are going to give some extra marks for you for your post graduations, or some kind of benefits can be given to younger doctors to encourage them to spend some portion of their life, a few months, let's say 6 months or 1 year in rural centers and help in the development of the rural centers. So I think incentivization is very, very important.
We have to talk about the cost of getting healthcare, and especially the out-of-pocket expenses that are associated with the healthcare system right now, preventing perhaps a lot of people who want to go and get those medical tests done, or who want to follow preventive healthcare rather than reactive, rather than going to a doctor after perhaps something serious has happened. But the expense is something which is a huge concern. What's your take on that? How should we as a nation, as a country, as a system really be ensuring that healthcare becomes more affordable to the masses?
You see, if you see the healthcare in India is, although the government is supposed to look after, but if you see typically in the last 3 decades or so, only 20 to 30% of the healthcare is provided through the public healthcare system. 70% is provided by the private healthcare system. So what happens in the private healthcare system is that people have to pay out of pocket. And according to one survey, many people dip below the poverty line just because they've had one episode of some medical emergency in their house. They had to pay out of pocket, they had to borrow, they had to keep their land on rent or something like that, and then they could never recover. So I think very, very important is that we kind of use some means like an insurance, a state insurance or a government insurance or a private insurance or a company insurance, to see to it that the patient is not able to pay from his own pocket. There's some kind of an insurance cover, some kind of a support from either the state or from the employer.
I want to come back to preventive healthcare and ask you to speak about how important preventive healthcare is when it comes to the financial burden on the government.
See, when the Prime Minister was talking from the Red Fort and saying that let us focus on building toilets, and almost everybody found it very funny. But as a doctor, I think that was a breakthrough in the thinking process of the government. And let me tell you that ever since we started the Swachh Bharat Andolan, the incidence of gastroenteritis in children has come down by more than 50%. No, gastroenteritis itself was a leading cause of infant mortality, of childhood mortality, because all these waterborne diseases are happening. So just by this Swachh Bharat Andolan, in which we are talking about hand hygiene, toilet hygiene, has helped to bring down the incidence of communicable diseases. So that is giving you an example. 10 rupees spent on prevention can prevent 10 lakh rupees spent on the disease. So I think there is no doubt about that. Prevention has to be the forte.
What can you tell us about how India's status as being a medical tourism hub, how has that really evolved over the past few years? And what are some of the newer destinations that are perhaps evolving as medical tourism hubs? What can we perhaps learn from these hubs? What can you tell us?
You see, for years, Indian doctors have been regarded as high quality medical care by everywhere in the world. If you go to America, go to anywhere in Europe, in all the good hospitals, you will find that many good surgeons are Indians, many good cardiologists are Indian, many orthopedic surgeons are Indians, many transplant surgeons are Indians. So people have realized that, recognized that there is quality healthcare provided by Indian doctors. And many people would like to come to India if they are properly facilitated, if quality healthcare is provided, a better economic package is given to them. So, many of our, first of all, the easiest, the lowest hanging fruit is the NRIs who are staying abroad. They'll be more than willing to come back to the country and get the treatment done. So, I think if we provide quality care at an affordable cost, then the whole world will be open to come to India, and India can be the medical tourism hub of the world.
Dr. Kalhan, thank you so much for your time here on the show. I'm going to take a quick commercial break on that note. We are back in just a moment. I'm going to be in conversation and joined live by Godrej Memorial Hospital. Do stay tuned. Welcome back. With us here on IDFC First Bank presents Leaders of Tomorrow Season 11. We today are marking World Health Day by conversations with some of the most leading doctors and hospitals across the country. Joining me live on the show at this point is Lieutenant Colonel L C Verma of Godrej Memorial Hospital. Thank you so much, sir, for taking the time to join us here. We were just speaking with Dr. Kalhan and asking him to call out the big ideas for New India as he sees it. Perhaps we could start a conversation around that as well and ask you if there are some big ideas that you feel is going to be most critical for the healthcare space in the next few years. More so for entrepreneurs who perhaps are associated with this space. What would you have to say?
First of all, thank you very much for inviting me to your show. My ideas for the New India will be like on the lines of Niti Aayog 75 at the 75 vision document that states that India is witnessing a demographic dividend, means favorable demographic composition. To harness the potential, we need to have healthier and fitter demography. So, as you know, Indian population below 35 years of age group, we will be witnessing around 60% population under this age group. So, you can say India is going to be the youngest nation. So, here I want to make people more happy, more healthy, and you know that in the recent past we have witnessed the trend transition from communicable diseases to non-communicable diseases. So, here people have to be more free from NCDs and cancer, mental health and other stress related disorders. So, I want that more research to be done, more health related research and health related activities to be planned to make more fit and healthy Indians.
I understand Godrej Memorial Hospital has introduced genome testing for 150 conditions or traits. Can you elaborate a little on that?
We have recently launched a Health Genometer Smart Plan, which is based on whole genome sequencing. Here around 58 pathological markers will be tested along with your genetic markers, which will give a predisposition and risk factors for NCDs, those are non-communicable disease including cancer and mental related disorders and diabetes and others. This will be based on whole exome sequence rather than the microassay titer. So, this is revolutionary in the preventive health care, where you will come to know about the predisposing factors. So, it will be actionable lead time for you and for the consultant also, who can take note of high risk behavior and traits which is running in your blood. So, you get the critical lead time to diagnose and treat the patient.
Almost 2/3 of Indians aged about 25 to 60, and I'm just reading some reports here, I understand suffer from some kind of non-communicable disease, whether it's cardiovascular diseases, obesity, diabetes, etc. So, the genome sequencing that you're doing in the future, what is going to be the potential of that for identifying perhaps, some of these and really revolutionizing and changing the healthcare system in the country?
So, you rightly said NCDs are causing a lot of burden to the society, and in recent decade the transition has taken place from communicable diseases to non-communicable diseases. Genome sequencing is the need of the hour. As rightly said by Thomas Edison, I quote and unquote, the doctor of the future will not give medicine, but he will instruct his patients in the care of human frame, in the diet and in the cause and prevention of disease. So, genome sequencing will be revolutionary for non-communicable diseases. If I talk about this Health Genometer Smart Plan, which we have recently launched, here around 150 traits will be screened for, and on AI based bioinformatics platform, we will try to decode those high risk behaviors and traits which are running in your blood.
How impactful is this genome testing really going to be?
So, technology upgradation and innovations are the need of the hour. We have seen in COVID, the vaccine came very handy. So, genome sequencing is one of the tool where we can target the genes and identify the risk behavior. Based on that, you can get the critical lead time, and the doctors can also put the personalized regime. So, it is like a twofold advantage. One will be for early identification and detection of disease, and it will be cutting short of your catastrophic expenditures. So, it is going to be a revolutionary thing in the future.
We were discussing preventive healthcare with Dr. Kalhan, and I want to ask you a similar question in terms of how we can ensure that more people are prioritizing preventive healthcare.
There is a need of behavioral change, that mindset has to be changed. Prevention is better than cure. That is not the quote, we have to adopt this quote. Nowadays everybody is conscious, and we see people very health conscious nowadays. So, this has to be like adopted in your lifestyle, and you have to see that more initiatives are rolled out by the corporates, by the organizations and by the government also.
How can preventive healthcare play a pivotal role in your mind when it comes to alleviating really the financial burden on governments as far as the healthcare budget and the healthcare really is concerned?
As I initially said, preventive healthcare is going to reduce your catastrophic expenditure. We spend around 2.1% of our GDP. Those figures are of 2021. So, by adopting preventive healthcare, you will be getting many advantages. One is you will be getting disease free days. Second is you will be diagnosed early, and you can start your treatment early. So, in that case, those last stage terminal phase of the disease will not be there. So, you can reduce the expenditure on treatment part. So, it is going to be very revolutionary, and it will come very beneficial for the patient.
How's your hospital contributing to the overall health agenda? What can you tell us?
So, we are observing 75th anniversary of WHO, and the theme for this year is health for all. So, aligning with the theme, Godrej Memorial Hospital is also coming up with certain initiatives. The pro bono initiatives we have launched for the communities, like fitness club. We record BP and blood sugar and other parameters free of cost in the community. We try to create cardiac warriors by imparting CPR training to the communities and the first aid training. The other preventive healthcare plans we are running in the hospital are like system specific and age specific, including diabetes, hypertension or cardiac. So, we are a multi-specialty hospital having all the basic and super specialty services in house. we have state of the art cath lab and 4 modular OTs. Also, the unique feature we are housing in the hospital is HBOT, that is hyperbaric oxygen therapy. So, living up to our mission and vision, that is a center of medical excellence with quality health care. We are NABH and NABL accredited hospital, and aligning with the global agenda of health for all, we strive hard to provide affordable and quality health care to one and all.
We started by talking about the overall healthcare system, and I just want to go back to that and ask you how it can be improved. What are your suggestions?
As I initially said, technology and innovations are need of the hour. So, in healthcare also technology and innovations are needed for making operations and clinical process more flawless. They should lead to the clientele satisfaction. They should lead to cut down the expenditure. They should lead to better recovery and speedy recovery. So, research funding on research is required, and access to the health care, that is very needed. So, here we can like work out and more research and more technology can be adopted to create available, accessible and acceptable health care for one and all.
So, similar to that, what according to you are the biggest challenges that are plaguing the healthcare system? Lieutenant Colonel, what can you tell us?
So, coming to the challenges Indian healthcare is facing, one is obviously the trained manpower, that will result into the accessibility issue. Second is like funding. So, more primary funding, more primary spending is required, or public spending is required to be done to make affordable and accessible health care. Third is the research in cutting edge technology related to the health care. We need to have an upper end to diagnose the diseases at the earliest. So, here more technology or more innovations are needed, and unfortunately, we are not attaching that much importance to the research in the healthcare. So, that is one of the challenge.
All right, that's really the big picture conversation as far as India's healthcare system is concerned and healthcare really is concerned. A lot of ideas for us to take away from that. Completely out of time on today's conversations, but if you would like to see more around the healthcare space, here's how you reach us and give us your feedback. Our details coming up on your screens as we speak. Thanks for watching. Have a good night.